The AACP Council of Deans invited all U.S. colleges and schools of pharmacy to review the current state of pharmacy education to discover the innovative educational methodologies that help lead graduates to improve the practice of pharmacy. 21 schools participated, submitting 30 student-produced video responses. Out of these, several common themes emerged. We will look at these common themes individually and hear from student pharmacists around the country which innovative practices are impacting their vision of the future of pharmacy and how they can act as change agents to bring about improvements in patient care and delivery systems. Let's begin with application. Student pharmacists gain a view of leading change in international, domestic, and scientific communities, particularly when applied in community context. This student from Purdue University worked with other healthcare professionals in Kenya, developing perspectives about the priorities of the community as a means of affecting positive outcomes.
My experience in Kenya has definitely changed my perspective of pharmacy and how I can be a leader of change.
Another common theme involves engagement. Here, a simulation of real-life experiences places Ohio Northern students in the role of patients, physicians, and pharmacists, using a web-based learning and communication program to enhance the experience for students in earlier parts of the program.
Ultimately, I've learned that trust and communication are vital between the patient and the pharmacist, just as much as medical knowledge is for the pharmacist.
Diversity in patient population and experiences provided in IPPE programs, such as this one from the University of Maryland, allows students in their P2 and P3 years to follow a patient longitudinally over the course of their involvement.
One of the main lessons actually is the correlation between classroom knowledge and real-world settings. Building a bridge between her trust and the knowledge I've gained so far at school so that I can better help the patient. The second lesson I've learned is working with diverse patients and having diverse experiences. The patients that I've had experience with come with multifaceted issues. Many different times I've had to sit with them and talk with them, and it's given me an opportunity to develop an open mind, an analytical perspective, and be more culturally and socially aware in terms of a healthcare setting.
Interprofessional education, or collaborative work with other health professionals, is emphasized in the early practical experience training at Western University College of Pharmacy and other health profession programs.
But through IPE, and we discussed various cases, and I learned that pharmacists, we have a responsibility to discuss about our patients' medication with not only with the physicians, but with nurses and podiatrists and other healthcare professionals that's involved with the patient healthcare.
Empowerment as a theme is demonstrated here through a unique program at the University of Pittsburgh called the Executive Boardroom Series.
The Executive Boardroom Series allows me to interact with executives, people such as the president of CVS, and we get to talk about and discuss for 2.5 hours the implications of healthcare, the healthcare dollar, and discover how we will be better leaders for the future of pharmacy.
And one of the things this class really gave us was really how to excel and become a leader in the profession. It challenges us to go out and achieve that same level of success, because what it has really showed us is that we have the tools to do it. We just kind of have to make our own path.
Responsibility to patients and to the profession occurs when students are engaged longitudinally through team-based provision of pharmaceutical care, as shown at Auburn University.
And I felt like I had a sense of responsibility to those patients because they were real people and they depended on us to come to their houses every week and provide that counseling that they seeked, and any questions that they may have had, or to even change their drug regimen with the help of our preceptors or our mentors in PPE.
Mentoring. At the University of Minnesota, a leadership emphasis program features interaction with local and national pharmacy leaders.
A relationship I have with my leadership network partner is, in my mind, going to be a mentor and a friend for life.
And how they can make significant changes to the profession, impact patient care by not only being positional leaders, but also by being non-positional leaders.
The elements of change in almost all submissions to the AACP Council of Deans combine aspects of all these themes. And it's that personal commitment to people and communities, the interaction between pharmacist and patient at all levels of pharmacy practice. The face of change is the human touch.